Some 57 million rural Americans depend on their hospital as an important source of care, as well as a critical component of their area's economic and social fabric. But many rural care providers have faced, and continue to face, a rocky road ahead. Attracting and retaining workers, financial stresses, dealing with complicated and sometimes conflicting regulations, these are among the factors that can jeopardize the ability of rural hospitals to provide patient access to care. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hedderly with AHA Communications. AHA has made improving access to rural health a top priority. Our 2024 Advocacy Agenda for lawmakers and policy recommendations to government agencies lays out the groundwork for needed change to improve the system for patients. In this podcast, two AHA experts drill down into some of the specific steps needed to help essential rural healthcare providers stay solvent, healthy, and able to serve the patients and communities who depend on them. The discussion took place at the 2024 AHA Rural Healthcare Leadership Conference in Orlando, Florida.
Good day. I'm Lisa Kidder, Senior Vice President, AHA Advocacy and Political Affairs. I am joined today by my two colleagues, Travis Roby, AHA Vice President of Political Affairs, and Shannon Wu, Senior Associate Director, AHA Payment Policy, two of the experts on rural health care. Welcome, Shannon. Welcome, Travis. We all know rural hospitals continue to experience ongoing challenges that jeopardize the ability to provide local access to care and essential services to their patients and community. Examples include workforce shortages, financial instability, overwhelming regulatory burden, just to name a few. AHA continues to work with Congress and the administration to enact policies, or sometimes to stop policies, to support these rural hospitals. Recently, we announced our AHA Rural Advocacy Agenda for 2024. I am going to talk to Travis and Shannon about the advocacy agenda and share with you some of the details as we drill down a little bit. Travis, let's start with you. As AHA continues to work with Congress and the administration to support these rural hospitals, we're also looking to support a public policy environment that will protect access to care, innovation, and invest resources in new rural communities. Could you talk about those 5 areas, please?
Absolutely. Our first priority in our updated rural advocacy agenda is commercial insurer accountability. It continues to be an issue that we hear as a top-tier issue of concern for our members. Second is supporting flexible payment options. Third is ensuring fair and adequate reimbursement. Fourth is bolstering the workforce. And fifth is protecting the 340B program.
Great, thanks. So we'll dig into some of those issues here in just a minute. Shannon, as Travis mentioned, the number one he first mentioned, and maybe even number one on our priority list this year, is commercial insurer accountability. Can you talk a little bit about what's been happening with the administration and some of the actions they've taken to address this issue?
Sure. We've already seen some moves in the right direction from the administration from last year and the beginning of this year. So first, we are carefully monitoring compliance on the recent Medicare Advantage rules that were finalized last year, which went into effect last month in January. Many of these rules hold plans accountable for covering services and for their marketing tactics, among other requirements. So we're keeping a close eye on how those Medicare Advantage plans are complying with those rules for the upcoming year. Second, the administration also finalized, just last month in January again, prior authorization rules that the AHA advocated heavily on. These will go into effect in the next few years and are really aimed at streamlining and reducing burden associated with prior authorization and at promoting greater transparency. Of course, our work here is not done, and we continue to advocate for ways to reduce administrative burden and help our rural hospitals navigate through the changing Medicare Advantage landscape.
Thanks, Shannon. Sounds like lots of good work is being done. Travis, let's talk about another issue that has getting a lot of attention in Washington, D.C. right now from both sides, both those who are for it and against it. Can you tell us about site neutral and what is happening right now in Congress on the issue?
Absolutely. Hospitals and health systems play a critical role in preserving access to care for patients and communities throughout rural America. They've increasingly stepped up to fill the voids in care by reinvesting through access points like hospital outpatient departments. These sites of care are essential services in so many rural and low-income communities across the country. our emphasis right now is trying to push back on congressional efforts to impose site-neutral payments, particularly for drug administration, but their longer-term vision is far more expansive than that. And the impact on rural communities is particularly acute. We've recently put out data that shows that disproportionately rural patients access care at hospital outpatient departments, and we want to ensure that that access continues going forward by opposing these site-neutral cuts.
And Travis, I hate to put people on the spot, but I'll put you on the spot. What do you think the chances are that Congress takes action this year on the issue?
Well, right now we've got, in the short term, the March 1st and March 8th government funding deadlines that put us at risk on these issues. The hope is that we can stave off any pending cuts in that government funding package that's going to move in the next month. But then we'll still have the lame duck session of Congress in November and December, where this will be a top-tier issue. So we need to make sure that our rural members and all of hospital leaders across the country are engaging with their legislators to make sure that the message gets delivered that the current payment model is essential to maintain access to care, particularly given the financially vulnerable position of so many rural and safety net hospitals.
Great. So that sounds like a call to action as well as an update. The next issue I know is one that rural hospitals and hospitals really across the country are dealing with that definitely peaked during COVID, but can you talk about workforce challenges? So Travis, I'll send it to you, but then Shannon, you may have thoughts as well of some of the issues you've worked on. So Travis, why don't you go first and then you can turn it over.
Yeah, this is a key area where there is the potential for possible bipartisan support over the coming months. The National Health Service Corps is up for reauthorization. We're also advocating for an expansion of graduate medical education residency slots. Over the last several years, we've seen investments in more GME slots after nearly a couple decades where there had been a freeze on those slots, but there are also rural-specific proposals like the extending the Conrad State 30 program, which allows J-1 visa waivers for physicians who train in the U.S. to be able to stay here if they practice in an underserved rural community. So there are a variety of key workforce provisions that are specifically focused on rural, but want to highlight one additional area, the SAVE Act. That's focused on workplace violence, such a key issue for employees and administrators at hospitals to take this issue head on. We just had a very successful almost 100 congressional staffers attend a briefing on this issue that really, I think, drove home to congressional staff the importance of this issue, and we're looking to make progress on that over the coming months as well. And that's a bipartisan piece of legislation in the House and the Senate.
Great. Well, on the regulatory front, we've been really focused on the proposed nurse staffing minimum rules that were released by the Centers for Medicare and Medicaid Services last year. We strongly oppose these rules. So while we agree that staffing is an integral part of providing safe, high-quality care, we believe that the proposed rules from last year really are an overly simplistic approach to a complex issue, and that if implemented would have serious negative consequences, not just for nursing homes, but across the care continuum, especially with ongoing workforce challenges that are preventing hospitals and rural hospitals especially from discharging their patients in a timely manner to subacute or post-acute places. So we are currently awaiting the final rule, and in the meantime have supported legislation that would prohibit the agency from finalizing those proposed requirements.
Great, thanks. I'm going to turn to Travis again for an issue that has perennially gotten a lot of attention. This is a 340B drug pricing program. Travis, I know that there's some interest in it right now on Capitol Hill. Can you bring us up to speed?
Yes, the House of Representatives has had some hearings on this issue, trying to make changes that we think are problematic for the program. There's also been some legislation, a draft legislation put forward by some of the members of the Senate who have been champions of the 340B program. We're currently evaluating that to provide comments as they continue to refine that legislation moving forward. But I think the key message is that we want to make sure that all 340B hospitals are reaching out to their legislators to continue to explain the importance of the 340B program, how it ensures that you can stretch scarce federal resources further, and particularly for our rural members, how important it is to maintain access to care in your communities.
Great, thanks. And just in the last couple of minutes, let me open it up to you. I know this is a question we sometimes ask our CEOs, but what's keeping you up at night? What's the unfinished business of rural healthcare that you'd like to see tackled? Shannon?
Well, I'll just continue on the 340B theme, and I want to mention here, obviously the AHA continues to oppose any efforts to undermine the 340B program, but in particular in contract pharmacies, and we know how important that is for rural communities. So we know that there are still legal actions pending in the federal courts, and much of that action has moved to the states, which the AHA is very supportive and poised to help states in protecting access to contract pharmacy. So that is something that we continue to monitor and continue to be engaged on for this year.
Thanks, Travis. Anything from you?
It really is site neutral for me. That's the issue that I think is front and center in Congress right now. There are certainly important provisions like extending the Medicaid dish cut moratorium that is essential for protecting the financial stability of the field. But I think right now the number one threat to the hospital field are site neutral payment cuts. And that's what keeps me up at night, concerned that at a time of continued financial challenges for the field, that Congress might unwisely try to pass that legislation. So again, one last call to action on that. Please continue to reach out to your legislators on that issue.
Great. Thank you so much to both of you. Lots of hard work being done. And again, thanks, Travis and Shannon, for all your help. I am Lisa Kidder, and thanks for listening. This has been an AHA Advancing Health podcast.
Thanks for listening to Advancing Health. Please subscribe and rate us 5 stars on Apple Podcasts, Spotify, or wherever you get your podcasts.